But compared to like the financial sector, you're thinking, okay, I put in two, I get like five, investors are.
Hi everyone, welcome back to the channel. We are still very much on the set of Untitled and we have another exciting founder with us. I want to do an introduction, but I feel like you'll do a better job. So hi Adewale, how are you doing today?
I'm well.
I mean, it looks like you're made for the camera because I was seeing a lot of hands going up.
I mean, I'm here already, so it's my best interest to enjoy it.
I love it. I love it. That's a good attitude to have. So let us into what your business is, what it's called, and the problem you're solving for exactly.
Okay. My name is Adewale Badejoko. Yes. The name of the business that I represent, that I'm proudly building, is called Frootify. Frootify is a health technology company, and at the core of what we want to do is make it easy for everyday Nigerians to be able to access healthcare and manage health, their most valuable assets, without stress, without breaking the bank. You know, it's funny, people don't think the word healthcare or health and fun can sit on the sentence together. And that's, again, not out of place, because to this point, the dimension to which it's being presented, you know, you have to sort of have very technical knowledge around it. You have to, in some cases, or in my own cases, go to medical school to be able to, you know, understand or make sense of it. And at the end of the day, it just looks like something for some set of persons. Now, here's the interesting thing. Every human being has health as an asset. So it just makes sense that if you're going to have health as an asset, which is the very fundamental basis for life, you should be able to actually take care of it by yourself. And I can draw, you know, analogy to finance. You have your money, right? You choose what to invest it in, you choose what to spend it on, you choose how you spend it, how, you know, whatever it is, essentially, where you save it. And you don't have to go to banking school or a financing school. However, you have a certain grasp of finance to be able to adjudge over that asset of yours. And that's the manner that we view health, especially because it's more valuable than all the money put together. And so why should the owners not be empowered to actually manage their healthcare assets? And when you look at the beauty of the Nigerian ecosystem where we live, of course, you are aware of the massive jackpot when it comes to healthcare professionals. No matter, and I can tell you this, no matter, and I don't want to be a naysayer, but no matter the amount of healthcare professionals and graduates you turn out, it will still be insufficient. And of course, many other things that are wrong. I'm sure literally 90% of Nigeria have terrible user experience with the current Nigerian healthcare system. And so it's not one that is built to, you know, favor the user, and many other things that are not going very well. And so we have two options. Either we sit and complain about what's not right, and then we keep rolling in the cycle, or we offer fresher perspective into how we can solve it. And so that's essentially the inspiration behind Frootify. It's okay, wait, guys, let's sit down. How do we really change this narrative? I mean, it's almost journalistic malpractice to talk about what is wrong with healthcare and you not mention Nigeria. But really, when we sat down as a team to sort of rethink healthcare vis-a-vis the growing population that we have, interestingly, a bulk of that population now are young adults, right? The youth and what you typically call Gen Zs, and will remain that way for a time. And so when you look at the future that is coming ahead, you can bet that if we do not sit down to rethink how we offer healthcare, then we're going to have a state of collapse, right? And what we currently have is insufficient. And so that's where the underlying thought started from. And so many revelations along the line of our thinking. Again, I didn't do this alone. I did it with my team, co-founder, and many other persons who were really passionate about this cause. And fundamentally, one of the very first things that we realized is actually prevention is better than cure, right? And it's like nobody talks about the preventive part of healthcare anymore. And that's because, again, many persons don't really understand how to go about it. So it's almost done in a very passive manner. And so how can we bring it to focus? If we focus really strongly on preventive healthcare, we have very high chances of reducing the cost of healthcare, engaging many other persons, and truly making it fun. And I think many other revelations would be, okay, what's the number that we have? We have a lot of youth population, right? Okay, so youth are characterized for strengths. There's a growing adoption as far as technology is concerned these days, right? And there's nobody who thinks or mentions scale. and you're not thinking technology. One time I sat down to myself and asked myself, if I, again, became a medical doctor, which I was on the path to, how many patients, right, will I be able to see in a day? And for my lifetime, how many really? The largest hospital has how many beds, right? And for the numbers that we have. And so there's no way you're going to really reach out to a large number and you're not going to think technology. But again, you need to also understand that we are a people from a place, meaning that there are certain contexts that revolve around us. There are certain peculiarities that really ties to us as a people. And so we're trying to also harness that peculiarity, that context, that this is Nigeria. It's a beautiful place, it's different to be. And so what really makes us Nigerian, e.g. community, right? And it's one of the things that we've also seen, again, in our thinking, is that it's easy to go farther. There's an adage that says, if you want to go fast, maybe go alone, but if you want to go like for a very longer destination period, go together. It's easy to get started on healthy lifestyle or healthcare when it's in a community of people, and it's not far from us, right? And the shared community is becoming a thing. And so all of this plus more actually started forming what would become Frootify.
So what's the business model? How does it work?
Okay, so again, like I said, the peculiarity of Nigeria is very involved in how you do business. I'm a businessman. Naira cover is very important. As much as we want, many persons to live a healthy life, we're also very careful that this is a business and has to generate profit to be able to run. And so the way Frootify works is it uses a combination of both physical model as well as digital model. So typically you download the mobile app and then you're able to get access to preventive healthcare products and services.
What kind of?
Thank you. I mean, it ranges from anything to fitness, to diet and nutrition, to even skincare, spa, to mental health care, right? To even, healthy products and services that you typically not get in your random supermarkets, right? But really more focused on healthcare. And this can either be accessed digitally, facilitated on Frootify, but can be picked up. I'm not sure what the last time we had time to swim. Some persons would love to actually do it. It's actually a very good, fantastic physical exercise, especially even if you have bone issues, right? It could really help strengthen. Well, many persons are not even aware that swimming is actually an exercise. And swimming is something that you can do and have fun at it, right? Remember, but how do you buy it? As a service, right? How do you know that it's a service? And so on the platform, we offer quite a lot in terms of education. So you can buy the services as your health goal, needs. I mean, I might probably be trying to put on some weight while some other person is trying to reduce the same weight. And so it takes cognizance of whatever your health goal is or what you desire to achieve. And then we are able to actually recommend and suggest for you. Okay, so the way the healthcare experience goes, like I said, we are cool, we are happy with what we do, we're trendy, right? We're really very refined. And so the way the healthcare experience goes at Frootify is not your typical doctor-patient approach, right? Like I said, health is an asset, so it's yours. And so if I'm coming to work with you along the line of your assets, there's a level of knowing that you bring on board. So it's a partner care, not a doctor-patient care. And so we call it health body on Frootify, not doctor, right? So you speak with a health body regardless of whatever the concerns you have. So speaking to mental health in this case, of course they are licensed to practice in that field and they are certified by Frootify, because it's one thing to actually go to school to know about something. Again, there's the Frootify way of doing things, and we have to be sure that you understand the Frootify way. And so these are certified, trusted professional guides actually, who you schedule to speak with on the platform. You pay easy peasy, and then you have some bit of information about them as well. So the experience again is, I know you, or I know something about you, and then you know something about me, and then we are coming to talk about it as well too. And then whatever happens in the course.
So what has been the biggest challenge trying to build this solution into what it is currently, even going forward?
Top of my head right now, I'd mention infrastructure gap. Again, health is one. The funniest thing is you can be having a pain in the leg, and then where you are feeling it is in the head, right? And so you need infrastructure that connects the full spectrum of healthcare. It's actually very lacking, and that's why you realize that whatever you do here, right here, if you have to move for whatever reason, marriage, career, whatever it is, to another location, you have to start your healthcare journey again, even within the same ecosystem. And that's one of the very big challenges. So there's no there's no syncing of everything that you do along that line. And so one of the hard work that we had to do is actually to start building what we call Frootify, which is like an ERP, right, that takes cognizance of all of these things. So whatever you do on Frootify platform with your health does not stop with that particular location or with that particular service or with that particular experience or product, right? So it's an immersive one. So it's really very tough and challenging. And I'm sure this is not just to the preventive health space, even to the curative, right? If you go to one hospital, you have to take your anthropometry again, and then when you go to another one, it's like, and it's really very stressful, especially if you're going to access care, because that's going to be the basis of all of this kind of stuff. Along that line is the lack of data that is really unavailable in this part. So it makes healthcare really very difficult, right? If you have data to do certain things, it's easy. So you can make predictions, you can incorporate other technology. Those are not available here. So we have to actually start, from the basis, having to first gather the data before you now start analyzing, and then before you can then move into, okay, if X is this and this is this, then this is probably what actually easy peasy. As a business owner, funding is always a challenge. We are in a green space. The healthcare space itself is growing, and so the preventive part of it is actually becoming a thing, especially with technology. And so funding isn't like readily available, and so you've got to really contest and fight, even with many known space and sector like fintech or maybe agritech and what have you. But aside that, yeah.
No, for you, I hear you on the funding part, but one of the things I like to do is get that element of surprise when anyone sits on this chair. And to be fair, I was surprised when you said your business was in healthcare. I was expecting something around food and
right.
I agree that healthcare is not giving the attention when it comes to funding that it deserves.
The challenge is because many persons, again, and I understand because I'm in the industry, those who understand healthcare don't understand the business side of it. Those who understand business don't know healthcare, right? So very, very rare, as in the case of Frootify, do you have people with good knowledge around healthcare management and systems, and then you have them as well with good, sound knowledge around business. And so that makes it a bit, easy. So people have not thought, oh, can we really do healthcare and it's not charity? Do you understand? And so that's why, people with capital won't probably look at it as, okay, how much can we make here? But compared to like the financial sector, you're thinking, okay, I put into, I get like, investors have been plotting kind of stuff, and it's easy. But again, that reality has not really come into many persons. Yeah. And then for us as a nation, we're not even sure how we're going to go about health. On some days we are playing welfareism, socialism, and on some days we're trying to, call people to come and invest and put fund in it, which is you're going to put capital and you're expecting some level of return back, right? And then on some days it's, access to the sovereign, it's our government needs to provide healthcare for us and those kind of stuff. So I think those are some of the dynamics that makes it a bit of a challenge to really get investment into this space.
I hear you, and I'm glad that at least on this show you're able to bring some of these things to life.
Hopefully we win. Right.
Yes, rooting for you.
Thank you so much.
Okay, so funding forward.
Yeah.
You're on the set of funding forward. What was your application process like? How did you know you were supposed to apply for this?
Okay.
Here, and what has been your experience so far?
Okay, so let me take it from what has been my experience so far. My experience so far has been quite challenging because when I do things, I go all in. Regardless of whatever it is that I've done in the past before, or experiences that might be similar, I think every experience is new. And so when I come on programs, especially where you get to have network of founders, I'm always looking forward to the quality of people that I'll be meeting on the founding side, because at the end of the day, these are going to become lifelong friends, brothers, business partners as time goes on. And so it's usually an amazing moment to learn, as everyone that you probably meet is also working on something great as well. And so yeah, the experience thus far has been a bit of amazing. Of course, there's the part where somebody gets to go home and is evicted, and so sometimes you don't want to really build too much attachments because it could be you going home. On other times as well too, you just really have to put in the work to make sure that it's not you as well. So it's been very tasking, I must confess. especially because there's a TV side to many of the things that you do, and that's hard work itself. So one has to actually learn being an actor, being on camera, and then just it's easy for you now, but again, for some of us, we are really just bent into the work, and so this time you have to literally have a camera around you, following you up and down, which is some other things. So yeah, it's been fun. In terms of applying for the program, again, like I said, we're hoping that through the program we'll be able to meet our funding gap, right? To give us another runway to be able to actually do this fantastic business that we think we have on our hand. And so that was like the first thing that we thought. But beyond that, for us, is we've come a long way as a business, as a team, even with our product and service. And so now we are more open to more persons coming to see the coolness that we're building called Frootify, right? And so it's also the part of, you're always going to be looking at something. You're always going to see something. Why not that something be Frootify? And so we are more open to, okay, we want our customer base, our user base, and potential users to really see what we are doing. There are many persons who will be plugged in, I'm sure, to the Frootify way of living, but don't know about it yet. And so this is a fantastic program. And so that was really also very big for us. The challenging part was having to be on the program for that long, especially for an entrepreneur. But all things are possible to do that belief. So we're here.
Okay, so what are your expectations post-show for the next 1 year when we're hearing about Frootify?
Post-show, top of my head is to have Frootify become operational in Lagos. I did mention that we're already operational in 2 Nigerian states and cities till 2025. And the truth of the matter, we get people come through our social media space and say, are you guys operational in Lagos? In fact, the way they ask is like, where in Lagos can I maybe access something? Not even, are you guys in Lagos? I mean, as far as Accra, Ghana, as far as UK, people saying, or those who've had experience, like, when are you guys coming now? I'm missing the Frootify experience wherever it is that they are. And so, all things being equal, we're hoping to break into the Lagos market operationally, and then see how things go from there. It's really very critical to our journey because, the Lagos market is really a place where you test your muscles as a startup, as a technology company as well too. And so that's something that we're looking forward to, and that requires some partnerships. And so we're hoping that will be possible. Thank you very much.
Okay, so where can people find you? How can people support you?
All right, thank you very much. I mean, I can take a lot of the support, even in Naira Kobo and in kinds as well too. So yeah, the very easy place is where literally many persons are, especially our target markets, and that would be our social media platform. We're really very big on IG for now, and so you have 1 or 2 things that you'd like to say to us or to share with us, or where you think we should be looking at, or maybe even one itself. And so the handle is Frootify Nigeria, although it's spelled FROOTIFY, then Nigeria without hyphen, Frootify Nigeria as well. So, and so you can always find and at least get started. But really, you can get your journey started on the mobile app. We're available currently on the Android Play Store, and also part of the things that we're looking forward to. I mean, this is not even going to be 2025. We're in the last quarter of the year, and so we should be available on the iOS for many users within that ecosystem as well too. But yeah, and so yeah, download the mobile app, and then we'll get your journey started. And of course, we're everywhere. We want to be like some brand that is everywhere you go, right? Hopefully, at least within the shores of Nigeria, we're everywhere. But now we are on literally every popular social media platform. The name is just Frootify Nigeria in some places, but Frootify.
Amazing. Thank you so much, Adewale.
Agatha, it's been a pleasure. Thank you so much.
To get great things about Frootify.
Thank you.